I'm here today with Dr. Rivera, an oncologist, to discuss a new drug on the market called Rubraca, also known as the small molecule Rucaparib, manufactured by Clovis Oncology. Could you start off by giving a brief description of the drug?
Yes, Rucaparib is an FDA-approved oral medication typically prescribed in addition to chemotherapy for women who have recurrent ovarian, fallopian tube, or peritoneal cancer. The drug may help maintain or delay disease progression when the patient's cancer diagnosis is terminal.
What are some of the side effects associated with Rubraca?
Some common side effects are nausea, weakness, anemia, and decrease in appetite. Among the more serious side effects are MS and AML.
When do you typically prescribe Rubraca to a patient?
There are two scenarios in which I prescribe Rubraca to a patient. The first case is if a patient has a recurrent form of ovarian, fallopian tube, or peritoneal cancer, and she has already been treated with chemotherapy. The second case is if the patient's cancer is a breast cancer or BRCA gene mutation, and she has undergone chemotherapy at least 2 times.
Since Rucaparib is categorized as a poly-ADP ribose polymerase inhibitor or PARP inhibitor, how does this inhibitor function?
As the name suggests, these drugs inhibit PARP enzymes, specifically PARP 1, 2, and 3. On the molecular level, PARP is a type of enzyme that functions to repair DNA that has been damaged. Regular healthy cells have 2 pathways to fix damaged DNA, meaning that if one PARP pathway is inhibited, healthy cells still have the ability to function normally due to an alternative repair pathway. However, cancer cells with the BRCA mutation possess one specific PARP pathway to repair damaged DNA. Therefore, when the drug binds to a PARP enzyme in a cancerous cell, it inhibits the DNA repair function in this cancerous cell and will eventually cause the cell to die.
Do PARP inhibitors such as Rucaparib inhibit any other tumors besides the BRCA mutation tumor?
It is important to note that PARP inhibition only works for DNA repair deficient tumors, BRCA mutations, which currently constitute about 25% of all ovarian tumors. However, an additional 35% of tumor cells are BRCA-like. In fact, many pharmaceutical companies, like Clovis Oncology, are working to expand the capability of PARP inhibitors so that these inhibitors can target BRCA-like tumors as well.
How does Rucaparib selectively inhibit mutated cells rather than normal cells?
Rucaparib is a form of target therapy. The molecule selectively targets BRCA gene mutations because these types of mutations are synthetically lethal. This means that BRCA gene mutations can be deficient when it comes to DNA repair, unlike normal cells that have normal functioning DNA repairing.
What features make Rucaparib an excellent inhibitor?
Well, let's take a look at the active site, pictured here. Rucaparib is a small molecule that is able to perform binding interactions with this active site on the protein. The molecule is a great inhibitor due to its ability to form many non-covalent interactions with the protein, such as hydrogen bonding, pi interactions with several amino acids, dipole interactions, and London dispersion forces. The molecule also has many functional groups: amines, amides, arenes, and haloalkanes, which assist in molecular interaction.
Looks like that's all the time we have. Thank you so much for the interview.